Hi, I'm Tony Kalloo.
And I'm Elizabeth Tracy, and today we're going to be talking about a study that we have here in the Department of Gastroenterology, taking a look at people who have pain after they've had their gallbladder removed.
Yes, Elizabeth, this is a really important study because we see many patients who, despite having their gallbladder removed, they continue to have abdominal pain. And quite often, the pain may be a result of ulcer disease or persistent stones after gallbladder removal. But in many patients, they continue to have pain without a good explanation. The goal of this study is to look at an entity which has a very complex name. It's called Sphincter of Oddi dysfunction. But it's a very simple concept. The Sphincter of Oddi is a small little muscle at the end of the bile duct. And in these patients, they develop pain because this muscle becomes dysfunctional.
Do you mind if we just back up just a little bit, and if you wouldn't mind telling me what percentage of people who have their gallbladder removed experience pain following that?
Having pain after your gallbladder removal is actually uncommon. We do over 500,000 gallbladder removal procedures a year in the United States alone. Less than 1 in 100 patients develop this problem. But yet when it happens, it's frustrating because you think you had your gallbladder removed for pain and you've had your gallbladder removed and now you're still having pain.
So for those people then, it's a big problem.
It's a big problem. And sometimes when the solution is easy, like an ulcer that was missed, or bile duct stones or irritable bowel syndrome was diagnosed after the fact, and then they get appropriate treatment, it's great because their pain goes away. But in a small subgroup of patients, the pain, there is no explanation. The pain persists and there's no good explanation. And that's where this study becomes important. This is a study, it's called the EPISOD study, and it's funded by the NIH. There are 8 centers in the United States, including Johns Hopkins, which are recruiting patients for this study. And essentially what we're looking for are patients who continue to have pain after gallbladder surgery, but have had a negative testing and negative workup, and there's no solution to their pain. These patients may have a condition, as I mentioned, called Sphincter of Oddi dysfunction.
So then let's go ahead and talk about the anatomy of the Sphincter of Oddi and why its dysfunction could cause this pain.
The anatomy is that the bile duct drains from the gallbladder and the liver system into the intestine. And this muscle sits at the end of the bile duct and regulates the flow of bile from the bile duct to the intestine. Because it's a very small muscle, there have been no real good tests, say 20 or 30 years ago, to diagnose this condition. Now we have developed some tests, one in particular called an ERCP, which is an endoscopic test where we pass a long flexible tube to the end of the bile duct and we measure pressures. Based on these pressure readings, we can tell whether this muscle is dysfunctional. The problem is it's very difficult. And in fact, before we had this test, many patients were told that they had a psychiatric problem or their pain was because they were not getting along with their spouses or something else like that. But now we know this is a real entity and this muscle can become dysfunctional. The problem is why the NIH funded this study was because we're not really sure if this is the best way to diagnose it, and we're not really sure what is the best treatment. The treatment currently is to make a cut or an incision in the muscle with the endoscope. The results have been mixed. Many people, including myself, do believe that this is the best way to treat it, but we're not really sure. And that's one of the main reasons that the NIH funded this study.
So when you say that this little muscle is dysfunctional, does that mean it's closed most of the time?
Yes, think about it. A muscle is like a valve. It's supposed to open and close. If the valve is too tight, then picture the bile backing up and then causing pain. And in fact, we at Hopkins, we actually did a study where we showed that in patients that have dysfunction of this muscle, there is increased pressures in the bile duct, which is the reason why we think these patients have pain.
And so what would be the other ways to diagnose this if it wasn't diagnosed by this endoscopic method that you described?
Some of the other ways is a special type of nuclear medicine scan called a technetium labeled HIDA scan. And in this scan, which we developed here at Hopkins as well, we believe that you can get a pretty good idea of whether this muscle is dysfunctional. Unfortunately, this test is not widely available. Not everyone believes that it's the best test, but it's a relatively non-invasive, quick test that we think works well to diagnose this condition.
So those are the two options with regard to diagnosis. What about with regard to treatment outside of taking this little nick in the muscle? Is there another type of treatment that's out there?
Other treatments that have been proposed, one, because it's a muscle, and botulinum toxin or Botox, as you know, has been used cosmetically to relax muscle pressures. You can inject Botox into the muscle, and it relaxes the muscle, it relaxes the valve, and it may cause relief of pain in patients with sphincter of Oddi dysfunction. The problem is, like with facial wrinkles, the effects wears off after a few months. So you may need to have repeat injections. But on the other hand, if you respond to Botox, then you could respond as well to having the muscle cut. Some investigators have shown that if you respond to Botox, you will also respond to the more definite procedure of having the muscle cut open.
Why have there been mixed results with regard to response to that strategy?
I think that the mixed results in response to the strategy is that sometimes patients may have received treatment who did not truly have sphincter of Oddi dysfunction because maybe the way we're diagnosing it is not the best way. And that's one of the great things about this NIH study is that it will help us to really see if this test that we're doing is the best way to diagnose sphincter of Oddi dysfunction. In other words, there are people who got treatment who did not have the disease as the cause of their pain. This study will help us to define those patients.
For people who would like to enroll in this study, what can they expect?
They can expect that much of their cost of the actual diagnosis and treatment will be taken up by the study. So there are some cost advantages for the patients. But I think also the thought that they're helping medicine and help other patients who have had pain after gallbladder removal, I think is also an important thing.
So patients then would get into this study really by referral, it sounds like. Is that right?
Yes, we've had patients directly contact us. It's available through the NIH website. They can contact us to our Hopkins GI website at www.hopkins-gi.org, or they can contact us by calling the Division of Gastroenterology. It's also available on the NIH website. It's called the EPISOD study, EPISOD study, and the website is www.clinicaltrials.gov.
When patients then are referred here, they can expect to have an endoscopic evaluation, and that would be followed by a procedure and then follow-up?
When a patient is referred, what happens is that we first interview the patient and make sure that there are no criteria that would exclude them. An example is if you have already had the procedure done, the ERCP with sphincterotomy, if it's already done, that's an exclusion criteria. They go through an interview process. And then if they meet all the interview criteria for recruitment into the study, the procedure is done after interviews. During the diagnostic procedure, the patient is then randomized or assigned to a particular group. Now, you may be in the treatment group or you may be in the placebo group, which means you don't get treatment. Because it's a double-blinded study, you will not know whether you receive treatment or not. And that's really the cleanest way for us to tell if what we did works. The nice thing about this study is it's weighted towards treatment. So most patients actually get treatment and only a small subgroup do not get treatment. But you will not know, nor will the person that's following your symptoms afterwards, will they know that you received treatment or not. But like in any study, you can drop out at any time.
And then how quickly after this treatment would someone who has sphincter of Oddi dysfunction expect relief of their symptoms?
That's a great question, Elizabeth. I think that the time varies from patient to patient. It may be as soon as 3 to 4 days, or it may be as long as 3 to 4 weeks, depending on various factors, including the amount of inflammation following the procedure, etc. So as long as 3 to 4 weeks in some cases.
And here's my last question. If the sphincter of Oddi is closed at sometimes and open at other times, is there a long-term consequence to always having it open?
Another excellent question. So there's no long-term consequence, and we know this because we've been doing sphincter opening procedures for many, many years. We do sphincter opening procedures to remove stones from the bile duct in patients, and there's really no long-term consequence of this. So it's a benign outcome procedure.
Excellent. Dr. Kalloo, what else would you like to add?
I think that if you have abdominal pain after you've had your gallbladder removed and you've had no explanations for your abdominal pain, I think you should seriously consider participating in this study.
Excellent. Thank you so very much.
Thank you too.